Well, this money provides us with a great opportunity to provide training for our staff, our clinicians and physicians, to free up time to create working group, committees, places where families, clients, and our teams can come together to talk about how we work together to improve care. We want to be able to meaningfully involve families and clients in program planning, facility design, program evaluation, and so those conversations will give us opportunities to potentially improve our facilities, make them more welcoming for families and for our clients, and to allow us to produce more effective information materials for families, perhaps an orientation for families to our programs. We really just want people to feel welcome. We want them to feel that they're included, that they're partners in care, and that they're part of everything we do. Yeah, it's a great question. Well, first of all, there's an acknowledgement embedded in this that while an individual might be affected by a mental health or an addiction issue, the family is also affected. People closest to that person are also affected, and we need to do more to support families. So part of what this money will allow us to do is to potentially put new programs and services in place to support families and educate families. Additionally, it moves us away from the place we've been in historically, where individuals receiving mental health and addiction care were often seen as recipients, people who needed expert advice and expert care. And what research tells us now is that while care providers have important information and treatments to offer, individuals and families need to be part of that process, and they need to be making decisions for themselves, because we know that leads to the best health outcomes over time. Well, we know it's a priority for the Ministry of Health and that they would like to see this approach embedded in all of our healthcare services. There are other healthcare providers who are actively looking at person and family-centered care. I'm not aware of any community that's looking at it across the whole scope and breadth of mental health and addiction programs in the way that we are. So I really believe we're leaders in this work in Richmond from a mental health and addiction perspective.
Fantastic.